Assalamualaikum and good afternoon to all of you. I hope you are awake to listen to the first presentation after your lunch. My topic is about going global in medical tourism. So I will try to make my presentation as simple as possible. Most of the time, I present in academic conferences, and normally the term I use can be quite difficult to understand. But today, I will try to my best to explain the concept of medical tourism and how, at the end, how are we to go global in medical tourism. The topic has very remote association with the theme of this session, but if you were to ask something related to the theme of the session, you can ask the question at the end during the question and answer session. So I'm going to look at, I will quickly explain the definition. We need to know about the definition of medical tourism and health tourism, why people travel for medical treatments. We look at medical tourism in Malaysia. After that, we look at competitor analysis. What are our competitors doing? Singapore, Thailand, and India. After that, I will present my study, my research paper, which just about to be published in the journal about Kuala Lumpur medical tourists. And toward the end, I will discuss about how are we going to go global based on our analysis okay. As we know that tourism is one of the 12 initiatives proposed by the National Key Economic Area that could help Malaysia to become a developed country by 2020. And tourism is singled out as one of the most promising and lucrative areas to be developed for that purpose. If we look at our tourist arrival, it's increased tremendously by 10% every year on average. But our health tourists increased 3 times more than that. So that means this is the best subsections of tourism that we should develop. And we are not the only one developing health tourism. There are other countries, and our main competitors actually now Singapore, Thailand, and India. And we're going to look at that as well. I hope you can learn from this slide during this presentation, which try to explain to you the difference between health tourism and medical tourism. Because a lot of time, when we read newspapers, they interchange the terms health tourism and medical tourism. So let's look at one by one of the term health. What is the definition of health? Health is a state of complete physical, mental, and social well-being. That's the definition of health. Not only about not getting sick or not having any illnesses, but also about achieving a complete health, mental, and social well-being. Tourism. Tourism is about travel somewhere and all the activities involved to host the tourists. So that's tourism. So if we combine the two terms, health and tourism, we can define health tourism as travel to a destination and all activity involved to host the tourists. And those who travel, the main purpose is to attain or to get a complete physical, mental, and social well-being. And health tourism includes spa, wellness, and medical tourism. Yeah? You see, health tourism is a bigger what you call it, scope. And medical tourism is a subset of health tourism. That's we must understand. So what is it, medical tourism? Aims at restoring health through medical intervention by the application of biomedical procedures. That means we go to the hospital, doctors do something to our body. That's medical tourism. If you go to the spa, yeah, that's not medical tourism. That's wellness or spa tourism. So the definition, in short, medical tourism is defined as all the activities related to travel and hosting a tourist who stay at least one night at the destination for the purpose of maintaining, improving, and restoring health through medical intervention. I hope all of us clear by now the difference between health and medical tourism. Okay, we look at quickly why we have so many tourists coming to Malaysia for medical treatment. These are the lists. The most important one, the first one, of course, the cost. We are cheaper and we offer value for money to them. And the second is short waiting list. In developed countries like United States and UK, to do knee replacement, for example, or hip replacement, the waiting list could be 1 year. But if they come to Malaysia, they can get almost immediate attention. That's other reasons why they come here, because some of the treatments, for example, not approved by their government. For example, United States doesn't allow stem cell therapy, for example. Other reasons, like the insurance, health insurance they have does not cover certain procedures like dental, cosmetic surgery, fertility, etc. So, if it does not cover, that means you have to get somewhere. In their country may be too expensive, so they come to our country. Preference. If we notice later on, when I present to you, lots of our patients come from Singapore, and a lots of Singapore patients come from Malaysia. Why is that? Because Malaysians who live in Singapore will feel more comfortable to come and get a treatment in Malaysia, and vice versa. Because you have family support, so more likely if you want to have coronary bypass, you come back to your own country because you have your family members to support you. So these are some of the motivation why people travel. The rest of the list, if you like the slide, you can get from the organizer later on. Quickly, we go to Malaysia. Why we develop health tourism? We started to think about health tourism following economic crisis in 1998. At that time, suddenly, a lot of Malaysian patients cannot afford, because of the economic crisis, they cannot afford to get treatment in private hospital. So, in order to prop up the industry, private hospital, a government and private company decided to get to promote medical tourism overseas. Our main markets are Indonesia, Singapore, Japan, and West Asia. One thing about later on you realize Malaysia, the weakness of our medical tourism is we tend to attract tourists who don't spend very much. Yeah? Like Indonesian, you see that 72% are Indonesian. And the majority of them go to Penang. If you get the Penang statistic, probably 90 to 95% are Indonesian. If you get Kuala Lumpur statistic, will be a little bit different. And these tourists are lower middle income patients, so they don't really spend that much. Later on, I will present my study, which sample patient in Kuala Lumpur. So you see exactly the difference. Of course, we have lots of government initiative, like, we have Malaysia Healthcare Travel Council, which package and standardize the price for tourists. Government extended the visa for health tourists, provide tax incentive to refurbish wards and rooms, tax exemptions, and we provide as well good information from website, and that's the government initiative. What are our pull factors? Why we are special? We focus on high quality and low price offering. We are basically IKEA, yeah, IKEA of furniture. So we focus on our high quality and low price, but IKEA is not that high quality. But this is our health tourism. A well-trained and highly qualified medical personnel, world-class hospital equipped with state-of-the-art medical equipment, and we have excellent English proficient staff. Our population, multiracial, multi-religion, so that we could provide staff who could speak different languages and sensitive to different religions. And also we are Muslim country, very strong Islamic credential, so we could provide halal food and practice Islamic protocol. So this is very attractive to tourists from the Middle East, for example. And let's go to about quality. Most of our private hospital centers have achieved certification for internationally recognized quality ISO 9002 and the Malaysian Society for Quality of Health, most of them. But when we want to try to attract high quality medical tourists, the most sought after accreditation is Joint Commission International. And this accreditation is an important factor for medical tourism related agencies to recommend overseas healthcare center to their customers. At the moment, we have only 8 JCI accredited hospitals. Later on, I will compare with our competitors, and you realize where we are at the moment. Even though we think we are good enough, but probably we are not yet. A lot of things we need to be done. And we have problem with brain drain. Okay, let's go quickly on competitor analysis. Thailand, Singapore, and India. I'm not going to explain everything, but I will just highlight the important aspect. Thailand started very early, medical tourism. 1970s, they already started. At that time, lots of Western countries, they demand cosmetic surgery, some treatments like sex change that cannot be carried out. For example, lots of Malaysians went to Thailand for sex change in the 70s and 80s and until now, because we don't provide that. They have problem as well with economic crisis, and with the, in 1998, and with that, they developed their medical tourism at full blown. And if our main markets are Indonesian, Singapore, and rather cheap spenders, Thai markets, they are mainly from Japan, from the United States, from United Kingdom. So you can see the difference. Why they managed to attract this. And their estimated revenue there is 4 billion by 2012. Yeah, we are thinking about getting 3 million ringgit. That's 3 billion ringgit by 2012. Yeah? This is 4 billion US dollars. Okay, if we have 8 JCI hospital, Thailand has 14 JCI hospital, so more, almost double. Thailand, of course, provide lots of interpreters, which we don't need because we already multiracial. That's not the issue, but issue here, they have many more high-quality hospital than us. And Thailand also actively promoting their health tourism. So these are some of the examples of their promotional activities, like Thailand Medical Tourism Blog Contest, for example. They have e-marketing campaign, Healthy Beauty Holiday in Thailand, and they provide all the information. They have campaign, You Are in Good Hands, to highlight the safety and credibility of Thailand medical tourism. They also have familiarization tours, so they invite a lot of organizations to come to Thailand for a few days and familiarize with whatever medical and wellness facilities provided in Thailand. So they are very active in their promotion. We do that as well. It's not that we are not doing, but we are yet to find out why we are not as successful as Thailand. Singapore. Singapore is, of course, the top in Asia, still in terms of quality. And their expected revenue by 2012 is 1.8 billion US dollars. Their top market there, you see, Indonesian, Malaysian, Chinese, Middle Eastern. They may have Indonesian, Malaysian, and Chinese, but these are high spenders of Indonesian. The low spenders Indonesian will come to Malaysia because we offer cheaper packages. And look at the number of JCI hospitals. Singapore has 18. We have only 8. So they have 18. We have 35 hospitals which offer services and facility for medical tourism. Only 8 have JCI accreditation. Singapore has 20 hospitals offered medical tourism services, but their JCI is 18. So you can see almost all of Singaporean hospitals are of high quality. And they compete with top-notch quality, and they have high quality and complex medical treatments like neurosurgical procedures, liver and heart transplants, separation of Nepalese twins, etc. All the groundbreaking technology medical treatments. But of course, the drawback is expensive, and Singapore begin to think that they need to reduce down a little bit their price. And Singapore also organized world-class symposium, conferences, courses in medical field, which attract not only medical tourists, but potential investors and international scholars in the field. And Singapore has collaboration with reputable Western hospitals like Johns Hopkins University, Pennsylvania University Medical Center, Massachusetts, etc. Parkway, which is Singapore premier medical provider and the largest private medical group in Southeast Asia, now begin to branch out in other countries in Asia like Brunei, China, India, Indonesia, etc. Raffles Medical Group from Singapore as well, establishing strategic alliance and integrated networks with medical organizations from developed countries. You see what Singapore does? They establish network and alliance with developed countries, establish universities, but at the same time, they branch out their services in other Asian countries, less developed countries. And that's how they're only not getting money from their own country, but also from other countries. Quickly look at India. India has the same problem as Thailand and Malaysia. Economic crisis, and later on they start developing health tourism. India developed very fast because they could offer even cheaper than Malaysia. Even though they have low cost, this is something, they are low cost in terms of medical prices. But India highlight very little about this fact in their website, in the promotion. Us, we highlight a lot about our low cost. If you read newspapers, yeah, we highlight about our low cost. But India, the top 3 promotional messages, they have credential or accreditation, a list of services they have, as well as specialization. So that's the main thing. And the key competitive advantage are highly trained and qualified medical personnel. And of course, they have, like us, they have excellent ability to converse in English and agility to adopt Western technology and medical protocol. I think we more or less have this as well. Okay, we have 8 JCI hospitals, I mentioned, but India has 17 JCI hospitals. Probably they have more than Singapore now. That's how fast India is developing. One unique aspect about India that we also could develop is the fact of they are the center, one of the world centers in contemporary global medical tourism. They have contemporary medicine like Unani, Ayurveda, and homeopathic treatments. So this is something that they could combine together with their medical tourism. Not only that, India also produced doctors. Yeah, they have 229 recognized medical colleges, and they have students from all over the world coming to India to study medicine. And of course, when you study medicine, normally you stay in that country for 1 or 2 years in order to serve the country. And with that, they have steady pool of doctors in their country. Like Malaysia, government of India provide incentive as well as welcome foreign direct investment with lots of privileges. And like Parkway in Singapore, Apollo Group in India set up another 32 new hospitals in India They already have 30 hospitals, and now they ventures overseas to Nigeria, Shanghai, and Vienna. So India is very fast catching up with Singapore. But India, like Malaysia, they have problem as well with brain drain. Okay, now I'm going to go quickly on the study that I carry out in Kuala Lumpur about medical tourism. So the result that I present now is something very new, very fresh, and will be published in the journal soon. So you are the first one to see this result. Okay, I carry out study in several private hospitals like Ampang Putri, Sime Darby Medical Center, Sunway, Pantai, as well as Pantai Hospital Klang. It was very hard study because hospital didn't really want to cooperate. They don't want us to disturb their patient because the patient just finished treatment. And carry out for 1 year, distribute 400 questionnaire, but we managed to get 138 questionnaire. And from this hospital listed below, female, most of the patients were female, and 47% from Indonesia. We have 5%, 5.1% from Australia and New Zealand. And the main reason why they come is confirmed. They come to Malaysia because of value for money, because what they pay and what they get is really good. And excellent medical services and supporting services. Other motivations like cultural similarity and religion is less important. It's not important, but less important. Okay, if you look at how they source the information, 60.2% from friends and relatives, only 14.5% from internet. Why is that? If you want to have operation, you don't want to rely on the internet. It's obvious. You must rely on very credible source, and the credible source normally from your family and friends. And that's why it's 60% there. And most of them, they come to Malaysia with 2 others. That means 1 health tourist coming, another 2 coming. Yeah? So that's how they travel. And 20% had cosmetic surgery. Medical treatment about 41.3%, and surgical procedures 7.2%. But they also do other activities like touring, shopping, etc. Look at the spending. They spend a lot. Average total 26,000 per visit. That's what they. Bear in mind, this is Kuala Lumpur tourists, not Penang, not Malacca, not Johor. Kuala Lumpur tourists, and the sample are among those who actually stay in the hospital, not the one that come and go on the same day to do medical checkup. Some of the medical checkup require you to stay in the hospital, so we sample those who stay in the hospital. So if you look at the spending, 26,000, but 12,000 they spend on healthcare services, 3,000 on flight, international airfare, accommodation, another 3,000. Female, 20% of those who carry out cosmetic procedures, 89.3% of them were female. So female, a lot of them come for cosmetic surgery. And respondents from European descent, including Australia and New Zealand, they are more likely to carry out cosmetic surgery. And the average spending there is 26,000, is 12 times more than the average spending of other tourists. Yeah? Tourists normally come and spend about 2,200 ringgit in Malaysia. But health tourists that in my sample, bear in mind, this is not representative sample of the whole Malaysia. It's selected in Kuala Lumpur, those who stay, yeah? So it's not representative sample, but give you some idea how lucrative is medical tourism industry. I mentioned just now that they travel with 2 others. So that means in 2008, when this study was carried out, medical tourism related tourists could be as high as 1 million. That's the number. Of course, they're just a company, but it's related. Yeah? And then average length of stay, they stay for 15 days. Some of them stay for 2 years for chronic illnesses. Okay, if I time 15 and 26,000, that's about 9 billion ringgit. Now, of course, this is not representative, but this gives some idea how good is medical tourism business. But of course, this is purposeful and convenient samplings, not really representative. Tourists from European descent spend considerably higher, and female spend 3 times more than average tourists. So if you get female tourists coming, they are likely to spend 3 times more from their wallet compared to male. And they spend more in all other components like healthcare, airfare, accommodation, domestic transportation. There are other concerns which I'm not going to discuss with you today. Okay, let's go straight to why I'm here. How are we going global? How are we going to go to be international based on the baseline discussion that I've given to you just now? First, of course, Malaysia must be safe and secure. After September 11, Westerners a bit reluctant to come to Malaysia because they think Muslim countries are all the same. Yeah? So, government, the first thing that government should do in order to go global is to ensure that politically it's very stable. So, we should maintain our country as a moderate Muslim country. Any movement of extremism like tourist attack, like what happened in Indonesia and Thailand, must not be tolerated. The moment we have this kind of event, immediately it transfers the message to the world that we are not safe to be visited. It's good for us to remain moderate, because not only we attract non-Muslim, but the majority of Muslims are actually moderate. So they are more likely to be attracted to come to our country. Making our country safe, secure for other people to come, we must make sure it's accessible. That means it's easy for them to come. Like government must provide easy visa, the length must be good, extended. And when they come, transportation link, I think our external or inbound flight coming, we are good, well connected to the outside world. But once they are here, there are some complaints about our internal transports like taxi, etc., which could be improved. And any effort to ease tourist movement, like in-house travel agencies, which we already have in place in some of the hospitals in Malaysia. Accessibility is not about transport alone, it's not about visa, it's also about accessibility to the information. So we must provide proper website with good content, features, and functionality. So that must be in place if we want to go global. Even though I mentioned most of them make decisions from their friends and family, but when it comes to getting the detail, they will go into website. Yeah? So that's the importance of website. We must strengthen not only core products, but also supplementary products. From my study, our core products like our doctors, nurses, medical equipment, and facilities are very highly rated. They are satisfied with that. But there are areas that could be improved in supplementary service elements, like some tourists complain about the depth of advice given by nurses and doctors. The empathy, lack of empathy is too transactional, the way we talk to the tourists. We have some complaint as well during the survey. And some others like domestic transportation I mentioned earlier. And perhaps the most important to go global is quality. We do have quality, there's no doubt about it. We have 8 JCI hospitals, but is it enough? If we want to compete, it's not enough. Yeah? Look at the bottom line. The bottom line, Malaysia, 8. Singapore, 18, 17, India, 17, and Thailand, 14. We are the lowest among our competitors in terms of providing good quality hospital. So we have to work. Hospitals who want to compete, you must get JCI accreditation. The reason is because European tourists who are likely to spend more, and their women spend 3 times more, they normally get reference from travel agencies if the hospital has JCI accreditation. So, like it or not, we must work on that. And being a moderate Muslim, appeal to both Muslim and non-Muslim, I mentioned just now, with greater awareness of halal tourism. Halal tourism is about, I'm sure you know what halal means. Halal is permissible by God, yeah, by Allah. And tourism, I already mentioned just now. So any activities related to tourism which is permissible by Allah is considered as halal tourism. And Malaysia could well position this by introducing the concept of halal medical tourism, for example, stressing the use of halal medical products and services, medicine, etc. I think why we don't get as many tourists as what Thailand has is about our personality as Malaysian. Thailand is famous for friendly culture. And in a study carried out recently, we realized among our neighbors, Malaysians are the least friendly compared to Thailand and Singapore. Yeah? Malaysia is the least friendly. Even Singapore, whom we always say kiasu, 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 they are more friendly than us. Something we have to do this, yeah? And this is reflected in my study when the respondent mentioned that, yes, your doctor's excellent, your nurses excellent, equipment's good, but when it comes to talking to us, giving us advice, eye contact, politeness, the depth of empathy is not there. It's like we just provide services because we have to provide services. we don't really see patient as a person. So that's something that we could learn from Thailand. Maybe we should benchmark our frontliners by studying carefully the attitude of service provider in Thailand. So maybe that's what we need to do. About about India perspective, they have very developed complementary medicine. And this is something we can provide as well under our Malaysia Truly Asia umbrella. We said that we are Malaysia Truly Asia. We have Chinese Indian population, a great percentages. So if we were to develop complementary medicine, we could actually develop as well Chinese medicine as well as Ayurveda, etc. from India. And the expertise could be imported from there if we don't have enough. But we are Malaysian, truly Asian. So that means we are a part of China and a part of India. So that means this is something that we can develop together with medical tourism. And what we can learn from Singapore is quality. Yeah? We need to emphasize on quality. And some more information, I think last 2 slides, about how to go global. Among high-yield medical treatments discovered in this study is cosmetic surgery. So further exploration needs to be carried out in developing new treatments which are not yet available in certain countries, such as stem cell therapies. We actually can be quite proud with ourselves because we are among the pioneer in stem cell therapy. Perhaps efforts should be carried out to develop expertise which requires patients to stay longer for chronic illnesses, such as medical and orthopedic rehabilitation. I used to work briefly in Tan Tock Seng Hospital, Singapore Rehabilitation Hospital for several months. And in that hospital, you know, rehabilitation normally, they stay for 2 to 3 months, up to 6 months. Spinal cord injury, for example, bladder training, they stay for several months before they become independent. And I realized a lot of the patients from Malaysia. So that's how lucrative. If you stay for 3 months, definitely you have to spend a lot of money. Yeah? And perhaps more products and services could be designed to cater for pediatric patients as well as elderly patients. Pediatric patients are more likely to come with their parents as well as their relatives. So that means you get more spending there. As well as elderly people are more likely to have chronic diseases. So if we develop along that line, very likely we could get high-yield tourists. And Malaysia should avoid getting involved in controversial practices such as illegal organ trades, organ transplants. Make sure if we were to carry out organ transplant in Malaysia, the organs come from legal source, not coming from poor people in India or Cambodia who had to sell their organs in order to support their family. So we have to try to avoid this kind of activities in our medical tourism. Some other cultural sensitivity like sex change operation may also have to be considered. We don't know about the sensitivity of our culture and religion. And last slide is we need to tackle as well brain drain, which is the problem in India and Malaysia. How to tackle brain drain? Maybe by providing better salary, maybe by providing more attractive Malaysian society, politically stable, fair society, in order to attract lots of entertainment, which could attract workers who are creative, yeah, as well as intelligence, like doctors and other paramedics. And the other thing is probably by establishing more medical school, but of course we have to be concerned about quality as well, what kind of doctors we produce. Producing doctors in Malaysia could be of benefit, simply because we could ask, once they are graduated, they could serve us, yeah? And then if they are good, we could offer them good salary and they could stay. And with that, we provide enough pool for our medical services. Okay, with that, I end this, my presentation. Thank you very much for inviting me here.